Hey everyone, so today we are going to talk about tuberculosis. What is tuberculosis? So, tuberculosis is a chronic bacterial infection caused by the bacteria Mycobacterium tuberculosis that is contagious through droplet and airborne. There are three classifications. The first one is primary tuberculosis or the primary infection stage, which the name implies, the patient's first exposure to the TB pathogen. In some cases, patients who've had TB can have what we call dormant TB, where the TB bacilli are within the tubercles and are inactive for months, decades, or even for life. These people are asymptomatic and is not infectious. When a dormant TB reactivates, it is called post-primary tuberculosis, which is the second classification. This happens especially when a patient becomes immunodepressed. The third and last is disseminated tuberculosis or miliary TB. This occurs when the TB bacilli gets into the bloodstream or lymphatic system and travels to other sites of the body. Pathophysiology includes alveolar consolidation, which is defined as the accumulation of fluid in the alveoli. This is caused by the dilation of pulmonary capillaries in an attempt to fill the infected sites with leukocytes and macrophages. As a result, it causes the alveolar epithelium to swell, thus the accumulation of fluids along with the macrophages and the leukocytes. Another one is caseous tubercules or granulomas. In TB, the lung tissues on the infected areas form protective cell wall called tubercle or granuloma. It functions to contain and encapsulate the TB in an attempt to prevent it from further spreading. As the lung tissues form tubercles, it forms cavities and severe lung destruction occur as it progresses. When the bacteria is controlled, like after the treatment, the tubercle is replaced by tissue fibrosis and calcification, resulting to bronchiectasis along with hypersecretions. The disease tuberculosis was named from the term tubercles, which was discussed earlier. It is primarily caused by the Mycobacterium tuberculosis, an acid-fast bacilli. They are aerobic organisms, meaning they love oxygen. That is why they thrive mostly on the apices of the lungs, where there is high oxygenation tension. TB bacilli can remain suspended in the air several hours after a cough or a sneeze. That is why, as I've mentioned before, it is airborne and droplet.